be submitting to FDA in the next 30 days. Generally, a medical device such as this, the FDA is supposed to process the application within 3 months of receipt.
So we should see it this year.
I certainly hope we're going to see it this year.
Hopefully by the second half.
Certainly hope that that's true as well.
And where, I understand the couching, we're dealing with the government. And what do we expect to see where, in terms of where it could be purchased? Do you expect to be given it by your health plan, or where would somebody get this?
I think the initial people who have access to this will have access to it through the disease management programs that their health plans have already enrolled them in. And we expect to probably some of the first consumers to get access to this outside of the insurance channel will be children who attend diabetes camp every summer. And for those of you who don't know the diabetes world, there's a magic network of diabetes camps around the country where children with diabetes really learn how to have completely normal lives while caring for their illness.
That's fantastic. We have a few minutes for questions. So do we have mics in the room? Okay, we do? Okay, so you can ask a question to me or any one of the panelists. So just raise your hand and please wait for the mic. And if you might just state your name and if you're with an organization, what organization?
My name is Barry Lotion with Connexus. My question is with regard to the glucose meter. I've been diabetic almost 50 years and was a camper and counselor at the Joslin camp up in Massachusetts. My question is relative to making use of your blood glucose monitor and taking the data and making it really usable. So my question is, are you looking at taking, let's say, a series of readings over one, maybe daily or every 3 days or every week, and then aggregating that information to actually do an assessment or have some sort of decision tree that allows that if it's so many standard deviations away from the norm or from the target, then a text message will go out to the patient to say, giving them a learning opportunity or an aha moment that says, oh, they need to really focus on this. Have you incorporated that? Are you going to? Or where are you on that?
I've had the privilege of having many lives, and one of my first lives was as a professor in epidemiology and public health at Johns Hopkins. And doing that kind of data analytics is a passion for me. That said, today we're telling the FDA that this is a product that will measure blood glucose as well or better as current products in the market, that it's equivalent to those products, and that it offers two-way data communication. I'm optimistic that in the future we'll be able to use this data in a way that really helps people take care of diabetes in a way that's never been done before, but it would be premature for us to say that we've achieved that.
So Jonathan, just to be clear, you're out totally in favor of what he's suggesting, but there's an FDA hurdle to get through.
I live, eat, and breathe what you're suggesting, but first we've got to get the basic foundation built. We've got to capture that data so that we can do what you're envisioning.
Well, that would mean that there's an open door to other companies and startups and folks who can take that data versus you guys doing it, having it at arm's length, to have them come up with the texting and the messaging and the wellness, if you will, care for the diabetic, actually take that data and respond to it.
Absolutely.
Okay, over here.
Hello, Henry Spraggins from Walgreens. I just have a general question about the data, probably tagging on the last gentleman. With all these data going around, are you allowing the patient or consumer to take that and be part of their personal health record and put that part of their cloud and then give that to the providers as they want to? Thank you.
Well, I can have a quick answer. Yes, if you saw in our diagram there, Google Health is there, and we also plan to integrate with Microsoft Health Vault beyond our own database.
Let me add from Qualcomm, we have a platform called TuneNet, which is under development, which actually takes data from many, many different devices and arms the consumer with the ability to choose how they use it, where they use it, if they want to share it with different applications so that they might get their own feedback from applications they provided. That's one of the key elements of that platform. I think that trend of being able to allow the consumer to grab the data, which might otherwise have only gone to the medical device company, is actually well underway today.
Next question over here.
Hi, Mickey McManus from Maya Design Labs. So this is a question about the Telcare product. It's pretty fascinating. So what do you expect the price point to be if I were just a retail person who wanted to buy it? And how do you think that's going to compete against the free monitors you can get today in terms of, how are you going to justify the difference in cost, and what might that cost be?
Sure. So the price point is $19.95 per month for the applications that I mentioned on an annual plan. And then you have the, I'm sorry, Telcare.
Okay.
I thought you said Telcare. I apologize. You go ahead.
The price point that somebody would see for this product at such time as it enters the retail chain, and recognize that on-the-shelf retail is not the first place we're going, is going to be comparable to the high-end brand meters that are on the shelf today. Yes, a lot of free meters are given away. Those meters tend to have a build cost, a parts cost of less than about $5. And free is good if free is what you're looking for. The real cost to the consumer in monitoring blood sugar is in the daily use test strips that people have to use each time they test their blood. And the price of the test strips associated with the Telcare meter is going to be the same as the price of the test strips associated with the brand name meters. It would not surprise me if somebody in the retail chain ultimately made a decision to give rebates on the cost of the meter if people use test strips. I mean, retail is retail, and there are certain price points, and it's critical to hit them in order to satisfy consumers. I'm confident that the Telcare meter, when it enters that side of commerce, is going to hit those price points that are necessary for consumers to be able to use it.
So the other point I'm thinking, if these are cell phones, so do I have to, or the cell inside, do I have to charge them every day? Or every 2 days?
The device has an on-off switch. If you turn the device off after every time you test, the current battery, and batteries get better by the millisecond, but the current battery in the product will last about 3 weeks between charges. If you leave the on-off switch on all the time so that it just goes into sleep mode in between tests, you'll need to charge the device every 2 to 3 days.
I think that's it.
All right.
I want to thank you all, Jonathan, Kian, Richard, Don. Thank you so much. It was really interesting. Great. Did you have any closing remarks?